welcome to the U.S. Open Health Desk presented to you by Mount Sinai. I am your host, Shauna Ryan, and joining us today is Dr. Abby Allen, Chief of Pediatric Orthopaedic Surgery at Mount Sinai. Dr. Allen, thanks so much for joining us today.
Thank you for having me, Shauna.
Of course. Coaches in tennis, so integral. I mean, coaches help nurture your love of the game. They can help you become a better player. And in today's show, we're going to be talking about the way that coaches maybe need to change their approaches when they're working with children who are developing physically, mentally, emotionally. So I'd love to ask Dr. Allen, what are some things that you think coaches should be aware of when they're working with a developing player who's kind of growing up through childhood?
Well, I think athletes really start playing as early as 8 years old. And so I think this is a great time to be a coach because children not only want to listen, they want to learn at this stage.
Yeah.
So it's a great time to be a coach and teach fundamentals, technique, and just an overall love for the sport.
Are there any guidelines that coaches should follow when they're working with children who are developing, in your opinion?
Oh, absolutely. I think as a pediatric orthopedic surgeon, I can't emphasize enough, you should not overtrain. So if you want to say, I want Johnny to serve 10,000 times a day, that's great and that maybe makes you better, but your bones and joints are growing and developing. So if you interrupt that growth, it can have a lifetime of repercussions.
So you really shouldn't think of these children as like tiny athletes. I mean, they're kids with very specific needs. It's not like you're working with an adult who happens to just be a lot shorter.
Exactly. Children are not small adults.
Yeah. Any other influencers in this case?
That's a good point because we're talking about coaching today. But in this age group, it's not just coaches. It's parents. Parents can be influences, whether good or bad. Sometimes, quite honestly, I see parents push kids a little bit. So parents can be good role models just as coaches can be good models. There are professional athletes. Children are very influential at this stage in the game, so I think looking at what professional athletes are doing is a good thing to do too.
Yeah, great examples, right? Role models in that case. You see it all over here at the Open, kids coming out to see their favorite players and see how they work.
Exactly.
It's fun to do.
Yes.
I'm curious about that phrase, practice makes perfect. You kind of alluded to this as well. Is it really true that more is better all the time when it comes to kids?
I mean, obviously practice does make you better. The more times you do something, the better you get at it. But there's a limit, and it's a fine line. And if you even go back to the professional athlete example we were talking about before, look at them as examples if you don't want to listen to me. Look at people like Michael Jordan, Chris Humphries, LeBron, Michael Phelps. If you look at, you know their sports they're known for, but if you look and delve deep, they actually were really excelled at other sports as well. Wow. So cross-training is a good idea too. That's a great
point. And like you said, it gives a break to certain joints and muscles that you're working over and over in one sport. Give that a rest. Let's develop some other skills.
Exactly.
That's great. So kids, as they go through different stages, one period of development is like middle adolescence, and it can be a really tricky time for kids, physically, emotionally as well. Any tips for coaches that are dealing with players who are going through this period?
Yes, I think in the early, when we're talking about 8-year-olds, they actually want to learn. Then you start getting into this prepubescent stage. They might challenge you a little bit. Their hormones are raging, so I think really taking these cues and listening to them. Do they want to play the sport anymore? Maybe they want to do something different, but I think playing a sport can empower them and conquer goals, so it is a good thing, but just really taking their cues because they're developing into a person.
Yeah, and that's hard sometimes because you want to push your kids to be the best, right? You want to push your players to be the best, but if you're not listening to how they're reacting to the game as they get older, you could miss, a cue that says maybe this isn't for them.
Again, it goes full circle. You need to have a love and a passion for the sport.
Yeah. So let's say you survive this period as a coach. Any advice for coaches working with children who are getting into more that later adolescence period?
Well, I think then it's a whole new world, and you are emerged out of that phase, and now your testosterone is higher, your muscles are developing, and it's a really fun time to be a coach because you're getting to be a better player, you're excelling. So I think that's the time to really take off.
So it's obvious that coaches play such an integral part in a player's life, and they can play many different roles for a player. Any final advice for coaches out there watching?
Well, I think keeping a love and a passion for the sport is the first and foremost thing. Number two, don't overtrain. These are growing children, and their bones and joints are growing, and you can actually have lifelong repercussions if you overtrain. So number three, cross-train. become an overall athlete, and love the game.
Oh, great advice. Dr. Allen, thank you so much for stopping by and giving us some great tips to help us grow up strong, healthy tennis players.
Thank you for having me.
Of course, and thank you for stopping by. Don't forget to come on by to usopen.org throughout the entire tournament for more great tips from our experts from Mount Sinai. Until next time, I'm your host, Shauna Ryan. We'll see you right here on the US Open Health Desk, presented to you by Mount Sinai.